Well, I'm sure some of you at home, maybe most of you at home, have some unused, old, expired medications in your medicine cabinet. Well, today, not just today, but especially today, there's a place you can take them. In just a few hours, the DEA's Drug Take Back Day will kick off at different spots all over Metro Detroit. This is actually video from last year, and today it's time to do it again.
That's right. The DEA has removed more than 9,600 tons of prescription drugs since it started the program back in 2010. The DEA Detroit Division covers Michigan, Ohio, and Northern Kentucky, working with partners that the DEA offers more than 200 collection sites in Michigan. This year, the DEA is starting to target the senior population. The agency is hearing about pill sharing among older adults living in care facilities.
So to talk about that, we are joined by Martin Redd. He is the DEA's Detroit Diversion Program Manager. Let's start with some of those concerns you talked about. Seniors apparently pill sharing, so you're trying to get those away.
Yeah.
Right. Well, and the biggest thing too, this program, completely successful initiative that we've done since 2010. To date, we've taken about 20 million pounds of drugs that would have gone on the street or would have gone in our water stream.
Right.
So we have collected those and properly disposed of them.
You know, I think part of what makes it so convenient for folks is that there's a place that they can go to, you can drop it off, and then you don't have to think about it
That's
again.
right. That's right. Yeah, so if you log on to DEAtakeback.com, put in your zip code, it will populate places nearest that zip code where you can properly dispose of any medications.
And are you taking any?
We're taking drugs, legal drugs,
Okay.
no illicit drugs. We will accept the liquids that are secured in their bottle,
Okay.
no needles or sharps, and no illicit drugs.
This may be a silly question, but why? Right? I mean, how damaging can it be to the environment, to our water sources, if these pills get thrown away or flushed?
Yeah, so that was not predominantly, but this is one of the reasons why we started this back in 2010, is people didn't have a way to get rid of their drugs. You know, they have a surgery, pills stock up in their medicine cabinets, and they just don't have a place to put it, so they would throw it down the toilet. We wanted to make sure that we provided a safe disposal place 2 times a year. We've been doing this in April and October since 2010, and that gave everybody the chance to get rid of these drugs twice a year.
And in addition to protecting the environment, we're also keeping our kids safe.
Yeah.
Absolutely.
Because how many go into the grandparents' medicine cabinet? And
all the time, yeah. So, you know, there was a study not long ago, 53% of 12 years old and older misuse legal prescription drugs.
12 years old.
Yeah.
Wow, that's incredible. That's why events like this are so important, and it's been so successful since 2010. Thank
Very
you for
successful.
joining us.
Thank you
and
so
again,
much.
If people want to go today, where can they go?
DEAtakeback.com,
Okay.
put in your zip code,
Okay.
and that'll tell you exactly where to go nearest your location.
And you said there are 200 spots today throughout the state of Michigan, so you're pretty likely to find one that's pretty close to you.
That's right.
Martin, thank you very much
Thank
for
you
coming
so
in
much.
today. Well, if you have some prescription drugs you'd like to get rid of, as we just mentioned, here's one more reminder, DEA.gov. You should be able to find that site locator for a drop-off. Again, the zip code, just find that spot that works for you.
And the hours, by the way, 10 to 2 p.m.
Well, legal battle before the state Supreme Court is now coming to an end.
We explain more on the dispute over a frozen embryo. That's next.